So I'm going to give you a very quick run through, a very, very high level. So if you remember, I don't know if you had a look at the posters at lunchtime or not, but there is all the stuff that we are engaged in the UK, and you can see up on the top left there what Rebecca was speaking about, and she very clearly made the comment that actually it had become effectively an international project. We've also got things on there like the PROM QOL thing, which is also connected with an international initiative. So in actual fact, these two diagrams are quite well connected, and this is a whole host of stuff that is being done under the auspices of EAT, and I'll come back to what that all is in a minute, but there's a lot going on, and TOFS makes a very big contribution to this in terms of individual people, as you'll see later on in the presentation. So I'm not going to go through all of that detail, but what I am going to do is just remind you, if you need reminding, what EAT is. So EAT is our International Federation of Oesophageal Atresia Global Support Groups, founded in 2011, originally with about 7 members, now 14 member associations, including obviously TOFS here, who were a founder member. We work very closely with an organisation called EURORDIS, which is the International Network on Oesophageal Atresia. That's a dedicated kind of international medical network for esophageal atresia, and note the spellings now are E-A, not O-A, because internationally we use the American spelling of esophageal. It's a multidisciplinary organisation, and I mentioned earlier on this morning about one of the first conference which they held, which was in 2010, and they do regular international congresses, and I'll just say a little bit more about that very shortly. So that's EURORDIS. And the other thing that's important is in all of this is what is EURNICA. I think EURNICA was mentioned this morning, and you may or may not know anything about this. I'm going to run through some stuff very quickly, but I would encourage you to go onto the TOFS website, where, if you've not seen it, there is a quite big expose on EURNICA. And you'll see a few of the slides that were made in a presentation that was given in June by Olivia Spivak, who is a project manager with EURNICA in the Netherlands, although you might be able to detect from her name she was originally from the UK. Spivak is actually not an English name, but anyway, it's a name, I think. And there are, EURNICA is one of 24 European reference networks, and I'll just sort of say, well, so what's a European reference network? So, a European reference network is, there's 24 of them on different things. One of them is EURNICA, which we'll come back to. They are networks, as it says here, of multidisciplinary healthcare professionals from specialised centres across Europe. There are about 900 hospitals, I think, engaged in these networks now. And they have these particular objectives: to pool expertise, share knowledge and resources, share good practice, develop next practice, as I refer to it, with guidelines, care pathways and so on. And this is all aimed at improving the quality of diagnosis, of care and treatments for around about 30 million people, yes, 30 million people across Europe who suffer from a rare disease. So EURNICA is the one which is most relevant to us. It is amongst its many conditions that it deals with, esophageal atresia is one of them, within something known as the esophageal diseases workstream. But there are other conditions which are dealt with, other gastrointestinal diseases, and diseases like congenital diaphragmatic hernia, gastroschisis, and so on. These are all within the network. But esophageal atresia has had a lot of attention, I'm pleased to say, and I'll give you a very quick run through of some of the things that have gone on. EAT is involved in very specific roles, along with patient organisations from representing other diseases. There are many, many patient organisations across those 24 networks. So you can see there what the areas of activity are. But the important thing is that the role is very much one where we are working, as I said this morning, increasingly collaboratively. Yeah. Each of the areas where Ernica is active has usually a joint lead. It's usually 1 or 2 clinicians and 1 patient representative. And for esophageal diseases, actually that should say that it is Johanna Frauthof. That's a little bit out of date because that's from a slide that was done in June. Anke Wiedemann is actually the president of EAT, and she's also the lead patient representative for all diseases related to Ernica. So we've got quite a lot of engagement in this network, and I think it's very important to say that part of Ernica's governance, there's a board and there's also a coordination team, and patient representatives are on the board. There are about 4 or 5 of them. Along with 1 representative from each of the 40 hospitals that are within that network, and also Anke, as the lead patient representative, is a member of the 5-6 person coordination team, which includes Professor Weinen, who should be giving this presentation, who is the coordinator of Ernica. It's based and led out of Rotterdam. And I have to advertise the fact that EURORDIS, the rare diseases umbrella organisation in Europe, with its 1,000 plus member associations, of which I was recently appointed a director, was absolutely instrumental in the creation of these ERNs. Yeah, the patient organisations and EURORDIS in particular lobbied hard for these networks to be set up. And that is one of the reasons why that patient representation is a fundamental part of the way the networks work. Yeah. As far as esophageal atresia is concerned, the work within Ernica is driven by something called the patient journey. And in fact, the patient journey concept has been adopted within Ernica as an umbrella type approach. Initially, the concept of the patient journey was something that was almost not independent of, but separate from other activities. And now the whole idea is that if you can't say which part of the patient journey a particular initiative is aimed at, then why are we doing it? Yeah, and that's the kind of acid test, really. So those are the stages of the journey which have been identified for esophageal atresia. You can argue about the definitions on there, but I think they're fairly self-evident, and 1 or 2 of us are quite interested in the last one. So what's Ernica done? And I'm going to run through this massively quickly. Do go onto the website if you want to find out more. I would encourage you to do so. Consensus statements, and there are several people in the room who were involved in this particular work, and there are patient versions of the consensus statements. So the consensus statements started off as very medically orientated, as they should be, because they're effectively the consensus statements guidelines for clinicians. But we now have patient versions of them, and they're available on the Ernica website. And everything on the Ernica website is, I think most of it's linkable from the TOFS website, or you go on the TOFS website directly to, I don't know, but you can get the information. Just heard about feeding and nutrition. So again, videos, lifelong follow-up, dilatations, gastroesophageal reflux. There are videos about all of these. And then we have another major initiative, and you're going to hear more about certainly the whole quality of life, mental health thing from Vukas shortly. But this is a fairly significant relatively new initiative within Ernica. Vukas very heavily engaged in it. I think, do you want to do the advert, or shall I do the advert? Yeah, a series of webinars are run by Ernica on this topic, and the next one is on December the, whatever it is, 6th. Have you got it on slide somewhere? I don't know, it is the 6th. December the 6th. Look out for the information on the website. If you go on there, it will tell you when it is. We'll try and find some better ways of advertising some of this stuff, because it is very interesting. I won't dwell too much on the CPMS, because that is the one thing I have to say, sadly, within the Ernica programme, which at the moment we don't have access to in the UK. and we won't let politicians get in the way of most of it, but unfortunately the politicians did get in the way of that, or we did collectively. Unfortunately, since Brexit, that is one thing that we've been excluded from. I won't go into all of the detail. If anybody's interested in knowing the backdrop to all of this, I can talk to them at length. But suffice to say that for all practical measures, we have remained involved with Örneke, and UK clinicians and UK patient representatives have remained involved despite the fact that we left the EU, and this is entirely at the moment EU funded activity, so we are still taking advantage of that. This is something which Simon will talk to you more about, the registry, and importantly what is going to go on in the next 4 years. There has just been a grant proposal. It's in the process of being approved by the EU, and there's a lot of activity, particularly around the esophageal diseases, esophageal atresia area. There's only two things there, achalation and so on, which are not exactly esophageal atresia, but they are things that we could be very well interested in. Lots of work there around, I mentioned this morning that respiratory, for instance, is an area that's going to get more attention. We'll continue to give attention to transition and adult care and nutrition. And now I'm just going to briefly talk about a few other things outside of Örneke. So I mentioned the International Network on Oesophageal Atresia. Last year, just over a year ago, was the 6th international conference, and quite a few people here were there from both the patient side and from the TOFS side and from the clinical side. And also we have the European Paediatric Surgeons Association, and I'll just mention briefly a transition adult care survey which has been carried out quite recently. Worth advertising the fact that Professor De Koppie is currently the president of EUPSA. And Nigel, who you heard from this morning talking about TOFS, is also a member of the EUPSA executive, and he runs what's known as the EUPSA network office. So, a little bit more about EURORDIS. The most recent piece of work which EURORDIS did was something called a Transition Adult Care Set of Consensus Statements. This was a very big piece of work. It started in 29. It was a bit interrupted by the pandemic. It was divided into 8 work groups, one of which again was around the area of quality of life, and again Wilco was involved in that. I was involved with this particular piece of work as well. And I'm highly summarising these 42 detailed statements, which is all patients should go through a structured transition process which measures and records their physiological and psychological status at circa 16 years of age. And all adult patients should be regularly checked for, in particular, respiratory, gastroenterological and nutritional issues. And there are many, many detailed recommendations for those with chronic and severe mobilities. And one of the things that comes out of this, and it's something which I'll refer very briefly to again down in the next slide, is the fact something which has been mentioned to me individually today, which is the absence of specialist adult centres for esophageal atresia patients. Hardly any country in the world has that. There's one in the Netherlands, and I'm struggling to think of anywhere else that's really got anything that's particularly well structured in that way. We need it.
Yes, sir.
EUPSA itself carried out a transition and adult care survey in 2022-2023. And there is a poster on the wall. Natalie, your poster is on the wall there. So originally, back in about 2019, 2020, Natalie did a survey of what was then the 20 centres within Örneke, and we got some very interesting data about the whole transition and adult care issue. EUPSA did a more extended survey, not only on esophageal atresia, but on some other diseases. 77 centres, certainly with respect to the ones that responded on the thoracic, as it was referred to, so that's CDH and esophageal atresia survey. So we're getting more data about what is an issue. And very, very, very briefly, summarising, and there will be a publication very shortly on this. The majority of the centres don't have a transition or an adult care programme in place. In the majority of the participating centres, there's no protocol available. Data is very, very scarce on either national or international registries. A minority of the centres claim to have an adult care programme, but interestingly, when asked a further question, it was clear that mostly they did not have any structured follow-up, and most of them didn't have an underwritten hospital policy about that adult care, which means that, of course, it could be turned off. And where such programmes do exist, very interestingly and quite gratifyingly, the centres do claim that they engage with the relevant patient organisations or organisation in their country. So, forthcoming initiatives, and this is where the whole thing becomes quite complex, and I mentioned this morning about the fact that one of the roles that we as a patient organisation, both TOFS but particularly EAT, find increasingly they're doing, which is responding to requests to get engaged, but bringing various things together. And one, that's good because collaboration is better than competition, but secondly, we don't have the capacity to support multiple projects trying to do the same thing. So, for instance, the respiratory consensus statements, which were published by EURORDIS in 2021, will be hopefully adopted in some work which Ernica is going to do, and one of the other ERNs, one that focuses on lung, we're going to engage with them to ensure that we have the right expertise involved in all of that activity. Similarly, on transition and adult care, we would hope to bring together the EUPSA work, the Ernica work, and work that's going on in some other ERNs, notably Eurogen, which is dealing with urogenital anorectal problems. And something which links in with what Rebecca Thursfield was talking about on the Ocelot core outcome set activity is there is a proposal, and this is not definite, but there's a proposal being discussed by INOEA to deliver or to develop some much more detailed patient-reported outcomes than the one quality of life one. And some of you may have participated, and I know there are one or two people who have contributed to the quality of life patient-reported outcome work that Simon and Natalie were involved in a year or two back. So the idea is to develop some detailed patient-reported outcomes around 9 particular topics, and the intention there is to make that qualitative information that would link with the quantitative information that came out of those core outcomes that were on that list of 14 that you saw from Rebecca. There's also I mentioned the mental health, psychological impact, quality of life work, which we'll talk, well, Booker's involved in, she'll not particularly necessarily talk too much about that, but that's another very important activity which brings together work from various sources. And then finally, I can announce, for those of you interested, which might be as much our medical friends here, that the next International Oesophageal Atresia Conference will be in Istanbul on April the 30th to May the 3rd, 2025. And the 8th International Conference is planned for 2028. And where is he? Paolo's up there. Paolo and I already had conversations in Cincinnati with people over there to try and persuade INOEA to hold that conference in the UK. Whether that will be the case or not, I don't know, but we can keep trying to persuade them to do that. Right. And finally, I just want to reinforce something. First of all, I have an apology to make. On a slide this morning, I mentioned the Medical Liaison Subcommittee and I missed the name of it. Sorry, Vanessa. However, she's on this slide. So, the people that have been very much involved with our international activity through EAT. Julia is not here today, but she was very much involved on the nutrition stuff, and if you go and look at that nutrition video, a lot of her work is basically embedded in that. Julia was in Cincinnati last year. She presented there. She presented at ESPGHAN this year, actually on the core outcome set. Vanessa attended ESPGHAN this year, so this is the European Society for Pediatric Gastroenterology, Hepatology and Nutrition. Caroline is increasingly involved in this, and Caroline's going to be our point person around this respiratory work, at least I hope she is. Kate is working with the Urogen ERN, so we're covering off some of the VACTERL issues there. Voco was involved with the inner ear transition study, as I mentioned, and she's very much involved with Ernica, and she also presented over in Cincinnati last year. And then finally, I'll mention Gary. Gary Spears is now a board member for EAT. Gary's a member of TOFS. He's on our adult working group. We don't see much of Gary because Gary works for NASA and he lives in California. But Gary is a 60-year-old survivor of esophageal atresia. I was just talking at lunchtime about Gary. He was a patient at Great Ormond Street. He was long gap in 1963, doing very well, and we do actually hope to see him next summer because he's planning to come to Europe. So that's our contribution. I mean, that bloke called Slater does a bit of stuff as well around this, but the point I'm coming to is a point that Duncan made earlier on, which is if you're interested, whether it's UK-based or international-based, if you're interested in getting involved, please let us know, because we could do with as much support as we can get. There's a lot of exciting work going on. As I've said before, we are increasingly being asked, and sometimes we don't wait to be asked. We make suggestions to say we would like to get engaged in these particular activities, and we are very much there. We're pretty much expected to be involved now in most of these activities. So please let us know if you're interested. If you've got any questions.